Hello everyone, this is Dr. Avani Ratan. I'm your faculty at Conceptual Psychology and I'm here today to discuss the memory-based recall questions from NIMHANS 2026. A year ago, we started Conceptual Psychology and the very first video that we recorded was for NIMHANS Recall 2025, and here we are today to discuss the same recall questions for the year 2026. So we could gather around 75 questions on the basis of the memory recall provided to us by the students, and we have tried our best to mimic and construct these questions which look same as what was asked in the examination. Now, starting with the first question, that which of the following is not recommended as an intelligence test by the Gazette of India, Rights of Persons with Disabilities? So the correct answer here is Raven's colored progressive matrices. Now, the Gazette of India notification operationalizing the RPWD Act specifies the Indian Standardized Intelligence Tests for certifying intellectual disability. So, Raven's colored progressive matrices, though a respected culture-reduced fluid reasoning task, is not amongst the notified instruments for issuing a disability certificate in India. Now, why is A incorrect? So, Mallin's intelligence scale for Indian children is a properly Indian standardized Wechsler type battery yielding a deviation IQ, hence it is notified. It is a recommended test, so it cannot be the exception. Second, which is Binet-Kamath test. So, Kamath's Indian adaptation of the Stanford Binet has Indian norms and it yields an IQ. It is recognized as an instrument for disability certification and therefore is not an exception. Then the NIPID Indian Test of Intelligence. Here, it is developed by the National Institute for the Empowerment of Persons with Intellectual Disabilities, specifically for the assessment, and it is also a notified test. So here, for the RPWD Gazette, for the disability certification, India relies on locally standardized IQ tests like the MISIC, like BKT and NIPID. Raven's CPM is not on the notified list. So the correct answer is D. Moving to the next question. In psychoanalytic theory, art is understood primarily as a product of A. Sublimation reflecting unconscious desires, B. Introjection of the superego, C. Reaction formation against guilt, and D. Regression to oral fixation. So the correct answer here is A. Sublimation reflecting unconscious desires. So Freud, he regarded the artistic creation as the paradigm of sublimation, which is the diversion of unacceptable libidinal or aggressive drive energy into a socially valued, non-instinctual channel. So the artist transforms the private unconscious wishes into a public, culturally sanctioned product. Now, why is B incorrect? So, introjection is the wholesale internalization of another person's qualities or values into the self. So, it is a building block of the superego. It is not a creative, productive mechanism. It explains how the conscience forms, not how art is made. Hence, this is the incorrect option. Moving on to C, which is reaction formation against guilt. So, reaction formation, it converts an unacceptable impulse into its conscious opposite. For an example, there is excessive kindness that masks hostility. So it is a defensive disguise. It is not the constructive transformation of the drive into valued work. So this is also incorrect. And regression to oral fixation. So regression is a retreat to an earlier psychosexual stage under stress, right? Oral fixation concerns either dependency or gratification themes. So this describes pathological backsliding, not a mature redirection that art usually represents, right? So in psychoanalysis, creativity or art is equal to, in psychoanalysis, creativity or art is usually equal to sublimation. So those who attended the live classes with us, you by now know that we covered this topic thoroughly during the live classes. So here in psychoanalysis, creativity and art is sublimation, and it is the mature or adaptive defense that produces something of cultural value. All right. So I hope this is clear. Moving on to the third one. In a one-to-one matching task, 100 students sequentially selected from 100 lecturers. Which student has the highest degree of freedom in the selection? The fourth student, the 25th student, the 95th student, or the first student? Now the correct answer here is D, which is the first student. So when choices are made sequentially from a shrinking pool, the number of available alternatives, which is the freedom to choose, right? The number of available alternatives is the freedom to choose. Right. It is maximal for the first chooser who faces all the 100 lectures. So this is maximal for the first chooser. Why? Because he faces all the 100 lectures. Each later student inherits a smaller remaining set, right? So here the fourth student is the incorrect option because by the time 3 selections are logged in, only 97 lecturers remain. Right. So this student's freedom is already reduced relative to the first one. The 25th student is again incorrect because only 76 options remain, and substantially it is constrained compared with the opening selector. Okay. And the 95th student, where only 6 lectures are left, this is nearly, which is the minimum freedom, the opposite of the correct answer, right? This person has the minimum freedom. So, in sequential constraint selection freedom, this is the highest for the first selector and it falls with every pick, which is the conceptual root of the logic in statistics. All right. So here the correct answer is the first student. So the fourth question is, Raven's progressive matrices is primarily a measure of crystallized intelligence, fluid intelligence, verbal comprehension, or working memory. So here the correct answer is B, which is fluid intelligence. So Raven's matrices demand abstract pattern completion and inductive reasoning with minimal language or learned content, which is the defining feature of fluid intelligence in Kittel-Horn-Carroll framework, right? Why the other options are incorrect? So crystallized intelligence, denoted by GC, It reflects accumulated knowledge, it reflects vocabulary and culturally transmitted skills. So Ravens is deliberately content free to minimize the influence of the acquired knowledge, so it taps the opposite construct. Why verbal comprehension is incorrect? Because this is a language-based ability. Ravens is non-verbal by design and it was created precisely to assess reasoning independent of verbal skill. So you need to keep this in mind that this was created by design, it was created precisely to assess reasoning independent of verbal skill. Alright, coming to working memory. So working memory is the temporary holding and manipulation of information. So while reasoning loads working memory somewhat, Raven is scored for inductive problem solving, not span maintenance capacity. Okay, so Ravens is the classic culture fair measure of fluid reasoning. It is a culture fair measure of fluid reasoning or intelligence, right? Denoted by JF. I hope it's clear till now. In Patanjali's Ashtanga Yoga, the process of single-pointed concentration is termed as A. Niyama, B. Dharana, C. Pratyahara and D. Dhyana. So those who attended the live lectures with us before the exam, they'll definitely know the answer to it. So the correct answer here is B. Dharana. Why? So dharana, it's the sixth limb. It is the deliberate fixing of attention on a single object point or an idea. So it is an effortful act of concentration. It is an effortful act of concentration, which is the sixth limb. Right? Niyama, it is the second limb. This is the second limb where there is personal observances, where there is discipline, right? Purity, contentment, self-study. It concerns with the ethical self-regulation. It is not attentional focus. So this is the ethical self-regulation. It is not about focus. Pratyahara, it is the fifth limb. This is the fifth limb, right? This is the withdrawal of the senses from the external objects. It precedes and prepares for concentration, but it is the turning inward step, not the concentration itself, right? Remember, it precedes and it does prepare for concentration, but it is more about turning inward. Then comes dhyana, which is the seventh limb. So this is meditation. It is uninterrupted. It is an effortless flow of attention that develops once dharana is sustained. So it is the result that follows successful concentration. It is not concentration per se, right? So this is meditation. So the sequence is here that pratyahara is sense withdrawal, then there is dharana, which is concentration, then there is dhyana, meditation, and samadhi, which is absorption, right? So, single pointed concentration is specifically dharana. Now, a woman who lost her job presents with anxiety, insomnia, and loss of confidence. So, within Indian psychology, this distress is best explained by tamas, klesha, anamaya kosha, or sattva guna. So, this was also covered during the live lectures. So, here the correct option would be B. So, the kleshas are the root afflictions that cause suffering in yogic psychology, right? It causes avidya. What's avidya? Ignorance. Right? It causes asmita. What is asmita? It is egoism. It also causes raga, which is attachment. Right? Then there is dvesha. What is dvesha? Dvesha is aversion. Followed with abhinivesha. Which is clinging to life or fear. So, the distress following the loss and the threatened identity is best framed as the operation of kleshas. Now, why tamas guna is not the right answer? Because tamas is one of the three gunas, which is the quality of nature, right? These are the qualities of nature. It denotes inertia, dullness, and heaviness. So, here we studied this, right? It denotes inertia, dullness, and heaviness. So, it is a descriptor of mental quality, not a model of how psychological suffering arises. Okay. Then there is anamaya kosha. Why is this incorrect? Because this is the outermost, the food or the physical sheet in the pancha kosha model of the self. Right? So, in the pancha kosha model of self, this is the outermost, you can say, the sheet. Okay, so it refers to the gross body layer, not to a mechanism of emotional distress. Now, the sattva guna. So, sattva is the guna of clarity, harmony, balance. So, this is clarity, harmony, and balance. Right? So, this is essentially the opposite of a distressed state, so it cannot explain the presentation. So, in Indian psychology, psychological suffering is a conceptualized thought process through the kleshas, which are the afflictions. Right? It is distinct from the descriptive gunas and the structural koshas. I hope this is clear. Moving on to the next question. Which Piaget achievement is the earliest indicator of mental representation and problem solving? A. Object permanence. B. Assimilation. C. Accommodation. And D. Conservation. So, the correct option here is A. Object permanence. So, object permanence is the understanding that objects continue to exist when they are out of sight. It emerges in the sensory motor stage and it is the first behavioral sign that the infant can hold an internal mental representation, which is the foundation of symbolic thought. This is the foundation of symbolic thought, right? Because here the child understands that the object is still there even though it is not in front of his or her sight, right? So the infant can hold an internal mental representation. Now, assimilation. So assimilation is a process of adaptation. It is fitting new experience into existing schemas. We studied this during the live class, right? It is not a developmental milestone or it is not an index of representation. It operates across all the stages. Then accommodation, it is also an adaptation process. It alters the schema to fit new information, right? So like assimilation, it is a mechanism of cognitive change. It is not a marker of any emerging representations, right? Then comes conservation. So the grasp that quantity stays constant despite changes in the appearance, right? It appears much later in the concrete operational stage. So it cannot be the earliest indicator, right? So this was in sensory motor stage. The question is asking about the earliest indicator. Conservation appears in concrete operational stage. So yes, this can't be the earliest indicator. So object permanence is the sensory motor stage, which is the hallmark marking the onset of mental representation. Moving on to the next question. According to Durkheim, suicide resulting from excessive social regulation is termed as egoistic, altruistic, anomic, or fatalistic. So here the correct answer is D, fatalistic. So Durkheim's fatalistic suicide arises under excessive regulation, right? It is oppressive control and blocked futures that leave the individual without any hope, right? Who can be the examples of such a case are the enslaved people or the prisoners, right? So here D is the correct option. Why egoistic is incorrect? Because it is caused by too little social integration. The person is insufficiently embedded in the social bonds. So this lies on the integration axis, not on the regulation axis. So this is about the integration axis, not regulation axis. Altruistic, it is caused by excessive integration where the individual is so absorbed in the group that the self-sacrifice for it feels obligatory. Again, it is an integration phenomenon, not regulation, right? This is again integration. It can't be explained by regulation. Okay. Anomic, it is caused by too little regulation, normlessness, right? It is caused by too little regulation, which is the normlessness, right? Typically during sudden social economic upheaval, or it is the regulation axis opposite of fatalistic. So Durkheim's two axes, integration which is egoistic and altruistic. and regulation, which is the anomic and fatalistic. So here excessive regulation is fatalistic. So D is the correct answer. Now, Blatt's theory identifies which two types of depression? A. Endogenous and reactive. B. Aneclectic and introjective. C. Melancholic and atypical. And D. Primary and secondary. So here the correct answer is B. Aneclectic and introjective. So Blatt distinguished aneclectic depression, which is, what is aneclectic depression? Organized around dependency. All right. So this is organized around dependency. There is loss, there is fear of abandonment. It distinguishes from introjective depression, which is organized around self-criticism. So introjective is around self-criticism. Okay. It is about guilt. It is about failure to meet your internal standards. So I hope these two are clear. Now, why the other options are incorrect? Why endogenous and reactive is incorrect? So, this is an older biological versus situational dichotomy. Okay. Internally generated versus precipitated by life events. This is unrelated to Blatt's personality or vulnerability framework. Hence, this is incorrect. Then C, which is melancholic and atypical. So DSM specifiers describing the symptom features like melancholic, anhedonia versus atypical mood, reactivity and hypersomnia. These are all DSM specifiers. These are not Blatt's typology. So here this is the incorrect option. Now primary and secondary, this is a general classification. Depression as a standalone versus arising from another condition. This is again not Blatt's two configurations. So Blatt gave analytic and introjective depression, where analytic is about relatedness, dependency, and introjective is about self-definition or self-criticism. So I hope this is clear. Moving on to a statistical technique used to reduce a large number of variables into fewer underlying dimensions is A. Regression analysis, B. Factor analysis, C. Discriminant analysis, or D. Cluster analysis. So here the correct answer is B, which is factor analysis. So factor analysis, it identifies the latent factors that explain the pattern of the intercorrelations amongst many observed variables. So it reduces the dimensionality. All right. So regression analysis, it either predicts or explains a dependent variable from one or more predictors, right? DV from one or more predictors, right? So it models relationships. It does not collapse many variables into latent dimensions. वो उसका काम नहीं है. Discriminant analysis, it classifies cases into already known groups. Okay. So here this classifies cases into already known groups. It is based on predictor variables, right? It is a classification technique. It is not a data reduction one. So you need to keep that in mind. Then cluster analysis, it's the group cases or the observations. These are not variables. So these are group cases or observations by similarity. So it reduces the number of cases into clusters, whereas factor analysis reduces the number of variables, right? So this one reduces the number of cases into clusters, but the factor analysis reduces the number of variables. So factor analysis is actually data reduction by uncovering the latent dimensions amongst variables, right? So it is data reduction by uncovering latent dimensions amongst the variables. So B is the correct answer. Next, the type of cell division that produces gametes with half the chromosome number is mitosis, meiosis, binary fission, or amitosis. So the correct answer is meiosis, right? So meiosis is a reductional division taking a diploid cell to 4 haploid gametes. Okay, here it is a reductional division. Why is it a reductional division? Because it is taking a diploid cell to 4 haploid gametes, which is halving the chromosome number. तो यहाँ से आपका chromosome number half हो गया and generating the genetic variation through crossing over, right? So here halving the chromosome number and generating the genetic variation through crossing over. What is mitosis? It produces 2 genetically identical diploid somatic cells. This produces 2 genetically identical diploid somatic cells. It conserves. Keep in mind, it conserves. It doesn't half it. Alright. It will not reduce the chromosome number. It does not make gametes. Does not make gametes. What is binary fission? It is the asexual division of the prokaryotes, which is the bacteria, right? So it is irrelevant to eukaryotic gamete production, right? So this is the asexual division of the prokaryotes. Of the prokaryotes bacteria, which is a bacteria. It is irrelevant to the eukaryotic gamete production. It is irrelevant to the eukaryotic gamete production. So binary fission is the incorrect answer, and then comes amitosis. This is the direct nuclear division without spindle formation, right? Direct nuclear division without the spindle formation. Right? Or it is the orderly chromosome separation, you can say. Or you can also call it the orderly chromosome separation. Fine. It does not produce the precise haploid gametes, which meiosis does. So gamete formation is meiosis, which is the reductional division to the haploid state. So keep this in mind. So B is the correct answer. Now, the Mallin's Intelligence Scale for Indian children, MISIC, is standardized for which age range? A. 3 to 15 years, B. 6 to 15 years, C. 6 to 16 years, and D. 2 to 18 years. So, MISIC, which is the Indian adaptation of the WISC, it is the standardized test for children of roughly 6 to 15 years, which is B. So, 3 to 15 years is, it extends the lower bound too far. MISIC's norms begin at age 6, not 3. 6 to 16 years, this is the age band of the original American WISC, not the Indian MISIC standardization. Okay. It is not the Indian MISIC. Now, 2 to 18 years, it is far too wide and matches neither MISIC's lower nor the upper limits. Okay, so MISIC, which is the Indian Wechsler Intelligence Scale Test adaptation, it covers 6 to 15 years of age group. So, B is the correct answer. A, C and D are the incorrect ones. Now, Brodmann area 17 corresponds to the A. primary auditory cortex, B. primary visual cortex, C. primary motor cortex, and D. Broca's area. So, Brodmann's area 17, right? It is in the occipital lobe, which is the primary visual cortex, which is the first cortical relay for visual information, right? So, the correct answer here is primary visual cortex. Here. So, primary auditory cortex is located to the superior temporal gyrus. It is located in the superior temporal gyrus. So, for physiological psychology, we have in-depth lectures which are present on the app. So, to get the in-depth knowledge and conceptual clarity, you can download the app and you can subscribe to the main video lectures for the MClinsci program. Alright, so this is located in the superior temporal gyrus. This corresponds to Brodmann areas 41 and 42. So, this is Brodmann areas 41 and 42. This is not 17. Then the primary motor cortex, it is the precentral gyrus, right? So this is precentral gyrus, which is Brodmann area 4. This is rote learning, so you don't have much option but to just memorize these. It controls voluntary movement, not your vision. Okay, this one controls voluntary movement, not vision. Then there is Broca's area, the motor speech area in the inferior frontal gyrus, right? So this is in the inferior frontal gyrus, which corresponds to the area 44, 45, which is far from the occipital area 17. So, Brodmann area 17 is the primary visual cortex. Hence, B is the correct answer. Now, a person learns that others are kind to her when she cries and begins crying to obtain that response. This is an example of A, primary emotion, B, secondary emotion, C, instrumental emotion, and D, tertiary emotion. Correct answer is instrumental emotion. So, in emotion-focused frameworks, instrumental emotions are expressed. These are often learned. Right? These are expressed to influence others or achieve a goal rather than a spontaneous direct response. So, the learned, the goal-directed crying fits this exactly. Primary emotion is an immediate adaptive here and now reaction to a situation, like fear at threat. So the described crying is learned and goal driven. It is not a spontaneous first response. Secondary emotion is a reaction to a primary emotion, right? Feeling ashamed about being angry. So it is an internal layering of feeling. It is not a behavior that is used to elicit others' responses. Then there is tertiary emotion. It is not a standard category in this classification. It is included as a distractor with no defined clinical meaning over here. So emotion expressed to obtain a social outcome is instrumental emotion, which is C. So moving on to the next question, which is the modal model of memory by Atkinson Shiffrin proposes which of these three stores? First is the sensory, short-term, long-term. Second is episodic, semantic and procedural. Third is iconic, echoic, haptic. And fourth, D is encoding, storage and retrieval. So the Atkinson Shiffrin multi-store. So this model is multi-store model. Proposes three structural stores, which is the sensory register, the short-term store and the long-term store, through which the information flows. So A is the correct answer. In B, where there is episodic, semantic and procedural, these are Tulving's subtypes of long-term memory. So this is Tulving's subtype of long-term memory. This is a finer division within one store. This is not the three stores of the modal model. Now, iconic, echoic and haptic. These are modalities of sensory memory, the visual, auditory, tactile, which is subdivisions of a single store. It is not the model's three-stage architecture. Last is the encoding, storage and retrieval. These are memory processes. These are memory processes or stages. These describe how information is handled. These are not structural stores, right? So the model is sensory, short-term and long-term stores. Now, moving on, which reliability estimate requires only a single test administration? Test, retest, alternate forms, internal consistency, Cronbach's alpha or inter-rated reliability. So here the correct answer is C, internal consistency, which is Cronbach's alpha. So internal consistency methods, which is the Cronbach's alpha, where the split half method or KR is 20, are computed from the covariation amongst items within a single administration of one form. Test retest is where it's required the two administrations of the same test separated in time to assess the stability. So here two administrations of same test which are separated in time to assess stability. So this is also beautifully covered by Anandeshwari ma'am on the app in detail, lectures for MPhil. Okay, so this is separated in time. To assess the stability, it cannot be obtained from one sitting. Then there is alternate forms reliability. It requires two parallel forms of the test. It is administered together or apart. A single form is insufficient over here. Then there is inter-rated reliability, which requires two or more raters scoring the same responses to assess the agreement. This depends on multiple judges. It is not a single administration item data. So, single administration, which is the single form, there is internal consistency reliability, which is known as the alpha. So, here C is the correct option. Next is the motivational state in which a person reasserts a threatened freedom by doing the opposite of what is demanded is termed as reactance, compliance, conformity or learned helplessness. So this is reactance, right? So Graham's psychological reactance is the motivational arousal to restore a freedom which was perceived as threatened or eliminated. This is often expressed by doing the very thing that is being discouraged, right? So I've covered this up in the social psychology lectures on the app. So compliance, when we talk about compliance, this is yielding to an explicit request or pressure. It is the opposite of reasserting freedom against a demand. Conformity, what is conformity? Adjusting one's behavior to match the group norms, which is again a form of going along with the influence rather than resisting it. Then there is learned helplessness, which is a passive resignation after repeated uncontrollable outcomes. So the person stops trying. This is the opposite of actively reasserting control, right? So threatened freedom is reactance. It was given by Graham. All right. Now, a logical argument consisting of two premises and a conclusion is a heuristic, syllogism, algorithm or schema. So here a syllogism is a deductive argument with a major premise A minor premise and a conclusion that follows necessarily from them. Okay, heuristic is a mental shortcut. It is a rule of thumb for quick judgment. It is a problem solving strategy. It is not a formal, precise conclusion structure. All right. Algorithm is a step-by-step indicator, right? It is a step-by-step procedure that guarantees a solution if it is followed. It is a method. It is not a deductive argument form. Then there is schema. It is an organized knowledge structure, right? Which is building on perception and memory. It is a cognitive framework. It is not an argument, right? So, two premises plus conclusion is syllogism, which is deductive reasoning. This is based on deductive reasoning. T-score has a mean and standard deviation of 100, SD15, mean 50, SD10, mean 0, SD1, mean 500, SD100. So here the correct answer is B, which is mean 50 and SD10. So T-scores are standardized scores with a mean of 50 and standard deviation of 10. Right? It is used widely. For example, it is used widely in MMPI. Mean 100 and SD15. This is the deviation IQ scale, Wechsler. This is not T-score. Right? Mean 0 SD1, this is the Z-score, which is the standard normal scale from which T-scores are derived. Right? Now, the last one, mean 500, SD100, this is the classic, the SATs, the GRE style, the GRE style standardized scale. This is not a T-score. Okay, so for a T-score, mean is 50 and SD is 10. Keep this in mind. Now, in acceptance and commitment therapy, the core goal is to increase A. Cognitive restructuring, B. Psychological flexibility, C. Symptom elimination, and D. Insight into the past. So, we covered this also in the live class, right? So, here the correct answer is psychological flexibility. The acceptance and commitment therapy aims to build the psychological flexibility through 6 interlinked processes. We discussed about that also. Acceptance, diffusion, present moment contact, self as a context, values, committed action, right? Which is known as the hexaflex. This enables the values which are consistent with the actions even when we have a difficult inner experience, right? Cognitive restructuring. This is a hallmark of traditional CBT, where the content validity of the thoughts is challenged. Whereas acceptance and commitment therapy, this explicitly de-emphasizes changing the thought content. It focuses instead on changing one's relationship to the thoughts, which is diffusion, right? Symptom elimination. So, acceptance and commitment therapy targets on workability and acceptance rather than the removal of the symptoms. So, this reduces the struggle to eliminate the symptoms as a part of this approach. Insight into the past. So, historical insight is a psychodynamic aim. Acceptance and commitment therapy is present and action focused. This is not insight oriented, right? So, this therapy's central aim is psychological flexibility, the hexaflex. Keep that in mind. Now, the highest stage in Kohlberg's theory of moral development is social contract orientation, law and order orientation, universal ethical principles, or good boy, nice girl orientation. So, here the correct answer is universal ethical principles, right? So, stage 6, which is the post-conventional level, is the orientation to self-chosen abstract universal ethical principles, which are justice, human dignity, which is the apex of Kohlberg's hierarchy. Now, social contract orientation, this is the stage 5, the post-conventional, right? Valuing laws or social agreements. It just sits before the stage 6. Then there is law and order orientation. This is stage 4, which is conventional, emphasizing on duty, authority, maintaining the social order. The good boy and nice girl orientation, stage 3, which is the conventional stage, which is focused on social approval and being seen as good by others. So Kohlberg's apex is the stage 6, which is the universal ethical principle. So it is C. Now, the favorite question for this year. Kohler's insight learning experiments were conducted on chimpanzees, the most famous being Sultan. Right? So Kohler's classic insight learning subject was the chimpanzee Sultan, who solved problems. He could stack boxes, join sticks, and suddenly he gave the evidence of insight rather than trial and error. So Sultan gave the evidence for insight rather than trial and error. Well, we do recognize all the human contributions, right? Why not animal kingdom as well? Now, Washoe. So, Washoe was a chimpanzee famous in American Sign Language research, demonstrating cross-fostered language learning, not insight. Then there was Nim Chimsky. He was a chimpanzee in significant language research that ultimately cast doubt on the ape grammar. It is also unrelated to insight studies. And then there was Kanzi, a bonobo known for lexigram or language comprehension work, right? So this is not for Kohler's insight experiment. Kohler's learning or Kohler's insight experiment was chimpanzee Sultan. Alright. Gertzmann syndrome resulting from dominant parietal lobe lesion includes all except agraphia, acalculia, fingeragnosia and prosopagnosia. So here the correct answer is prosopagnosia, right? So Gertzmann tetrad, agraphia, acalculia, fingeragnosia and left-right disorientation. It follows a dominant angular gyrus in the parietal lesion, right? So prosopagnosia is not a part of it. Here, agraphia is impaired writing, one of the 4 core Gertzmann features. So it is included, it is not the exception, right? So here, this is impaired writing. Acalculia is impaired calculation, a core Gertzmann feature, right? Fingeragnosia, inability to identify or name fingers, again a core Gertzmann feature. This is inability to identify or name fingers, right? So here the correct answer is that Gertzmann tetrad, agraphia, acalculia, fingeragnosia. It is not about prosopagnosia. So this is the exception. Now, the Dunning-Kruger effect describes the tendency of experts to underestimate their ability, low ability individuals to overestimate their competence, people to conform to group opinion, and memory to fade over time. So here the correct answer is B, which I have also covered in detail on the app in the detailed lectures for MPhil. Now, the Dunning-Kruger effect is that those who are low in a skill overestimate their competence because the same deficits that cause poor performance also impair the ability to recognize that poor performance. It is a double burden. Okay. So the first one is incorrect because experts to underestimate their ability describes the opposite tail of the effect, right? And it overlaps with imposter type underestimation. So it is not the defining phenomenon which centers on the unskilled overestimation of themselves, right? The third one, that people to conform to group opinion, this is conformity, right? Ashes type, social influence, right? This is unrelated to self-assessment accuracy. Then there is memory to fade over time. Either this is forgetting, decay, a memory phenomenon with no bearing on the metacognitive self-appraisal, right? So Dunning-Kruger is low ability and inflated self-assessment, which is a double burden of incompetence. Now, the case of Clever Hans, a German horse known for apparently solving arithmetic, illustrates insight learning, the experimenter expectancy, unintentional cueing effect, latent learning, or classical conditioning. So here the correct answer is B, which is the experimenter expectancy, unintentional cueing effect. So Clever Hans was responding to subtle, unintentional postural and facial cues from questioners rather than performing arithmetic questions, demonstrating experimenter expectancy and the need for blinded procedures. Why insight learning is the incorrect option? Because Kohler's sudden problem restructuring in chimps, right? Hans showed no problem solving insight, only cue reading. So this is the incorrect option. Latent learning is Tolman's demonstration in rats of learning without immediate reinforcement, which was revealed later that it was unrelated to cueing. Classical conditioning, Pavlovian stimulus response association. So while Hans cue reading is loosely associative, the case is specifically cited for experimenter expectancy, not a conditioning paradigm. So Clever Hans is experimenter cut. Last line दोबारा से start. So Clever Hans is experimenter expectancy or a cueing artifact. It is the basis for double-blind design. In the Blackie Pictures projective test, the central character is a cat, dog, horse, or a rabbit. So the correct answer here is a dog. So Blum's Blackie Pictures use cartoon scenes featuring a dog named Blackie to elicit responses which tap into the psychoanalytic or psychosexual constructs. Alright, the cat, the horse or the rabbit, none is the protagonist of the test. The central figure is specifically the dog Blackie with family figures like Mama, Papa and Tippy. So a dog Blackie is used for psychoanalytic projective assessment in this particular projective test. Now, the original thematic apperception test consists of how many cards? 20, 30, 31 or 10. So, Murray's original TAT, it comprises of 31 cards. 30 of which are the picture cards. And one is a blank card. Right? So 30 picture cards and 1 blank card, of which 20 are typically selected for a given examinee. Okay, so here 20 is the approximate number administered to an individual. This is not the total in the set. 30 counts only the picture cards and omits the blank card, giving an incomplete total. 10 is far fewer than the actual set, possibly confused with other projective stimuli. Alright, so TAT total cards 31, which includes 1 blank cards and 30 picture cards, and usually 20 are given to the examinee. Now, a single case design in which the intervention is introduced sequentially across behavior settings or people is withdrawal design, multiple baseline design, alternating treatments design, or changing criterion design. So here the correct option is multiple baseline design. So the multiple baseline design, it staggers the introduction of the intervention across the behaviors, settings or participants, and it demonstrates the experimental control without ever withdrawing the treatment. The withdrawal ABAB design, it demonstrates control by removing and reinstating the intervention. This is not suitable when withdrawal is unethical or effects are irreversible. Why C is incorrect? Alternating treatments design. This rapidly alternates 2 or more conditions to compare their effects. This is not a staggered sequential introduction. Changing criterion design. This shifts the performance criterion in graded steps to show behavior which tracks the criterion. It modifies a target, not the timing across the baselines. So sequential, staggered, and introduction is multiple baseline design. So here this is the correct option. So if the just notable difference in Weber fraction is 0.2, which is the just noticeable difference for a 200 kg stimulus is 20 kg, 40 kg, 4 kg or 200 kg. So by Weber's law, delta I represents the just noticeable difference, which is abbreviated as JND. So here I is the initial stimulus intensity, K is denoted as the Weber fraction, which is constant. So here, given that K is 0.2 and I, which is the initial stimulus, is 200 kg. Therefore, delta I by Weber's law is K multiplied by I. So here it would be is equal to 0.2, which is already given, into 200, right? So K here is 0.2 and I here is 200, which yields us an answer of 40 kg. So here the correct answer to this question is B, which is 40 kg. Why is it not 20 kg? Because when you calculate this, the results from using the K is equal to 0.2 and the Weber fraction that we used over here, The answer did not yield to 20 kg. 4 kg would actually result from using K as 0.02, which is a misplaced decimal. It's an incorrect fraction, right? And 20 kg is also incorrect, right? So Weber's law states that the just noticeable difference is equal to the Weber fraction and the stimulus intensity. All right. So here this is the formula that we would use to calculate it. So 40 kg, which is B, is the correct answer. Moving on. The draw a person test and the draw a man given by good enough test differ in that they are identical in purpose and scoring. B. Draw a man primarily assesses intelligence while draw a person assesses personality, emotional indicators. Draw a person measures intelligence only and draw a man is useful for adults. So here the correct answer is B. Draw a man primarily assesses intelligence while draw a person assesses personality and emotional indicators. So good enough's draw a man was devised to estimate cognitive maturity or intelligence from the detail and accuracy of the drawing. Whereas Makover's draw person is a projective measure interpreting emotional and personality indicators. So the first one, that they are identical in purpose and scoring, it's false. They have different aims. First is for intelligence and the second one is for personality, and they have different scoring rationales also. Okay. Draw person measures intelligence only. This reverses the relationship. Draw person is projective or personality oriented. This is not a pure intelligence test. Draw man is used only for adults. It is also incorrect. Good enough's test was developed for and the it was developed cut. Last point was start. Draw man is used only for adults. This is also false. Good enough's test was developed and standardized on children as well. Okay, so good enough draw man tests intelligence, whereas makeovers draw a person is personality and emotionally oriented. Now, the Binet-Kamat test, BKT, is standardized for which age range? 3 to 16, 3 to 22, 6 to 16, 2 to 18. So the correct answer here is 3 to 22 years of age. The Binet-Kamat test is an Indian adaptation of the Stanford Binet. It is standardized for roughly 3 to 22 years of age. Alright. So when you see the word BKT, it's for 3 to 22 years of age. Moving on. A negative correlation between two variables is represented on a scatter plot by points that slope upward from left to right, B. slope downward from left to right, C. form a horizontal line, and D. shows no pattern. So the correct answer here is it's B. It slopes downward from left to right. So in a negative correlation, higher values of one variable accompany the lower values of the other. So the point cloud trends downward from left to right. Alright. So the first option is incorrect because this depicts a positive correlation. Both variables are rising together. Okay. C is incorrect. Form a horizontal line. A flat line indicates essentially zero correlation. There is no systematic change in Y or as X changes, right? Shows no pattern. A formless scatter also indicates a correlation near zero, not a negative relationship, right? So negative correlation is downward sloping scatter from left to right. Now, the key distinguishing factor between prosocial behavior and altruism is that altruism always expects a reward. So this contradicts the definition of altruism, which is reward independent. Reward seeking helping is merely pro-social. It is not altruistic. It is performed without expectation of personal benefit. So this is the correct answer. Why? Because altruism is helping motivated by concern for another with no expectation of a personal gain. Pro-social behavior is the broader umbrella that includes helping done for any reason, including a self-interest. So this we had covered in the live classes as well. When it is legally mandated, altruism is voluntary and it is motive defined, right? It is not what distinguishes it, right? It's a contractual obligation here. Only occurs in groups. So altruism can be entirely individual, that one person is helping another. Group context is irrelevant to the definition, right? So altruism is selfless helping. It is a motive defined subset of pro-social behavior. Moving on. The feeling of knowing experience is best classified as a defense mechanism, metacognitive metamemory phenomenon, Jungian archetype, or form of deja vu. So here the metacognitive metamemory phenomenon is the correct answer. Feeling of knowing and the tip of the tongue states, right? It is a metamemory judgment. It is about monitoring whether currently unrecalled information is stored and likely to be retrieved or recognized, right? Why defense mechanism is the incorrect option? Because it is a psychodynamic construct protecting against anxiety. It has nothing to do with judging the content of one's own memory. Now, Jungian archetype, it is a universal inherited symbol. It is a pattern in the collective unconscious. It is unrelated to memory monitoring. Alright. Form of deja vu. So, deja vu is a false sense of familiarity with a novel situation. So, it is a feeling of knowing is an accurate-ish judgment about retrievability of specific information. It is a different process altogether. So, feeling of knowing is a metacognitive metamemory phenomenon. Alright. Now, according to Whelan's hierarchy of defense mechanisms, dissociation is classified as psychotic, immature, neurotic, or mature. It is C, which is neurotic. So, in Whelan's hierarchy, dissociation sits at the neurotic level, which is the level 3. It is alongside repression, reaction formation, displacement, and intellectualization. So, the psychotic level defenses, which is the denial of external reality, the delusional projection, the distortion, this is the, grossly altered reality. Dissociation does not reach this severity in the Whelan's hierarchy of defense mechanisms. Then, immature defenses such as projection, acting out, passive aggression, fantasy, these are more primitive. These are more disruptive than dissociation's neurotic level placement, right? Then talking about the mature defenses, sublimation, humor, altruism, suppression, anticipation, these are adaptive. So dissociation is not classified amongst these. So Whelan's places dissociation amongst the neurotic level defenses. Now, the Coconut Grove nightclub fire was the basis of Lindeman's foundational work on EMDR, stress inoculation, grief reactions and crisis intervention, and cognitive restructuring. So, here the correct answer is grief reactions and crisis intervention. So, Lindemann's study of survivors and the bereaved of the 1942 Coconut Grove fire characterized acute grief, and it seeded in the modern crisis intervention theory. EMDR was developed by Shapiro in the late 1980s for trauma. It is unrelated to Lindemann's grief work. Stress inoculation training, it was developed by Donald Mitchbaum as a CBT based coping approach. It is not derived from this. And cognitive restructuring, it is associated with Beck and Ellis within cognitive therapy. It is conceptually and historically distinct from Lindemann's grief studies. Alright, so here the correct option is C. Now, the number of pairs of spinal nerves in humans is 12, 24, 31 or 33. The correct answer is 31. Humans have 31 pairs of spinal nerves, 8 are cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. Alright. So 12 is the number of cranial nerve pairs. "24 does not correspond to any standard count of spinal nerves and fewer than the actual 31. 33 is the typical number of the vertebrae. It is not the spinal nerve pairs, right? So here the correct answer is 31. Moving on. Spitz's concept of aneclectic depression in infants is caused by genetic predisposition, prolonged separation from the primary caregiver, nutritional deficiency, or birth trauma. So here, the prolonged separation from the primary caregiver is the correct answer. Spitz described aneclectic depression and hospitalism in the institutionalized infants who were deprived of their mother or the primary caregiver for an extended period despite adequate physical care. Okay, genetic predisposition is incorrect because Spitz's account is environmental, it is relational. He attributed the syndrome to caregiver deprivation, not inherited vulnerability. Nutritional deficiency. So the affected infants were physically fed and the deterioration was emotional or relational, demonstrating that nutrition alone was insufficient. Birth trauma, a perinatal event or any sort of event that happened during the time of birth. Spitz said that the aneclectic depression was developed after separation in infancy. It was not from delivery. So here it results from the prolonged maternal or the caregiver separation, not from trauma. Okay, moving on. In Catel's 16PF, a high score on factor A, which is warmth, indicates a person who is reserved and detached, outgoing and warm, emotionally unstable, or suspicious. So here, the person is outgoing and warm. High scorers are warm, outgoing, and attentive on factor A. Okay, low scorers are reserved and impersonal. So when we say about reserved and detached, this describes the low pole of factor A, the opposite of a high score, right? When we talk about emotionally unstable, this relates to factor C, which is emotional stability. It is not factor A. Suspicious corresponds to factor L, which is vigilance. It is not warmth. So this is factor L. Okay. So a high score on factor A is a warm, outgoing person. Low is reserved. In Catel's 16PF, factor C represents emotional stability, dominance, vigilance, or apprehension. So factor C is emotional stability, which is A. It is the ego strength, where high score is, calm, mature, reality oriented, and low score is reactive and easily upset. Dominance is factor E. Okay. Dominance is factor E, assertive versus differential. It is a different dimension. Vigilance is, we just covered in the last question, factor L, right? Suspicious, wary, and versus trusting. That is factor L. Apprehension is factor O, which is worried, guilt-prone versus self-assured, right? So when I say versus, it is either the high component or the low scores that we are talking about. So 16PF factor C is emotional stability. Now, the elevated VRIN and TRIN scores on the MMPI indicate genuine psychopathology, inconsistent, random or fixed responding, defensive responding, or malingering. So, this tells us about inconsistent, random, or fixed responding, which is response invalidity. So, VRIN is variable response inconsistency. Okay. Variable response inconsistency is VRIN. What does TRIN denote? It is the true response inconsistency. True response inconsistency. So first we are clear with the full form of it. So VRIN, the variable response inconsistency, flags the random or the inconsistent answers. The true response inconsistency flags the fixed or the naysaying, the yay saying, yeah, or the naysaying. So both are validity scales detecting the inconsistent responding. Okay. Now, genuine psychopathology, the VRIN or the TRIN say nothing but clinical content. High scores signal that the protocol may be invalid, not that real pathology is present. Defensive responding. Defensiveness or underreporting is captured by the L and the K scales, not by the consistency scales. Okay. So, this is captured by the L and K scales. Malingering of physical symptoms, over-reporting. It is indexed by the F family and FBS scales. Okay. So, this is indicated by the F family or FBS scales, not the VRIN or the TRIN. Okay. So, here B is the correct answer. Now, pairing an anxiety-provoking stimulus with an incompatible relaxation response, as in systematic desensitization, is based on the principle of. ये तो सबको आना चाहिए because we did this in details and I also gave you the tables for all of it during the live classes. I'm sure most of you have the screenshot of that. So the correct answer is reciprocal inhibition. So Wolpe's reciprocal inhibition holds that an anxiety response can be inhibited by simultaneously evoking an incompatible response, which is relaxation. So this underpins the systematic desensitization. Now, the reciprocal sensitization, this is not an established principle. It is a fabricated or the distractive term. So, the genuine mechanism is inhibition of anxiety. It is not sensitization. Now, negative reinforcement. This is an operant process that increases a behavior by removing an aversive stimulus. It is not the classical counter conditioning mechanism here. Flooding, it is an exposure technique where you use intense, prolonged confrontation without graded relaxation. It relies on extinction, habituation. It is not reciprocal inhibition. Okay, so systematic desensitization works via reciprocal inhibition given by Volpe. Alright, the next question. A therapeutic technique in which the client is instructed to deliberately engage in the symptomatic behavior is termed A. Paradoxical intervention, B. Reframing, C. Systematic desensitization, and D. Thought stopping. So, the correct answer is paradoxical intervention. Paradoxical intervention is about symptom prescription. It instructs the client to perform or exaggerate the symptom, which undermines its anxious, involuntary maintenance and restores a sense of control. We discussed this also during the live classes, right? Reframing. Reframe is when it changes the meaning or the interpretation of a situation rather than prescribing the symptom behavior itself. Alright. Systematic desensitization is where you use graded exposure paired with relaxation to reduce anxiety. It does not direct the client to enact the symptom. Thought stopping. It aims to interrupt and suppress the intrusive thoughts, the opposite of deliberately engaging into the symptom, right? So, deliberately prescribing the symptom is paradoxical intervention. Now, mood incongruent psychotic features are those that match the prevailing mood state, do not match the prevailing mood state, occur only in mania, are always grandiose. So here the correct answer is B, do not match the prevailing mood state. So mood incongruent psychotic features have content inconsistent with the current mood, right? Like persecutory delusions during a depressive episode that lack the typical depressive themes or the guilt or the worthlessness. Fine. When it matches the prevailing mood state, this is the definition of mood congruent features, guilt delusions in depression. This is the opposite of mood incongruent. Occur only in mania. Mood incongruent features can occur in both depressive and manic episodes. They are not exclusive to mania. Are always grandiose. Grandiosity is just one possible content and is typically mood congruent in mania. Mood incongruent features are not defined by being grandiose. So, mood incongruent is the psychotic content that does not fit the prevailing mood. So, B is the correct answer. Lev Vygotsky's zone of proximal development refers to the gap between chronological and mental age, what a learner can do alone and what they can do with guidance, fluid and crystallized intelligence, short-term and long-term memory. So, what a learner can do alone and what they can do with guidance is what the zone of proximal development refers to. The ZPD is the distance between the independent performance and the higher level achievable with scaffolding from a more knowledgeable other, right? The prime zone for the instruction. So, a chronological and mental age, this difference underlines the ratio IQ concept, right, given by Binet or Stern, not Vygotsky's zone of proximal development. Fluid and crystallized intelligence is a Cattell-Horn distinction between reasoning and acquired knowledge. It is unrelated to assisted versus solo performance. Right? Short-term memory and long-term memory, distinction between memory stores, not a developmental learning zone. So ZPD is the gap between actual, which is solo, and potential performance, which is assisted. So keep that in mind. So B is the correct answer. Obsessions in OCD are characteristically experienced as egosyntonic, ego-dystonic, mood congruent or pleasurable. So this is B, which is ego-dystonic. OCD obsessions are ego dystonic. These are intrusive, unwanted, distressing, and inconsistent with the person's values and self image, which is why sufferers resist them, right? ईगो सिंटोनिक होते तो फिर डिस्ट्रेस ही क्यों होता, राइट? ईगो सिंटोनिक कंटेंट फिट्स द सेल्फ एंड इट इज नॉट एक्सपीरियंस्ड एज एलियन टू मी. It is characteristics of OCPD traits or some delusions, the opposite of obsessions, right? Mood congruent. It is a descriptor for psychotic features, relation to the mood, not the defining quality of obsessions. Pleasurable. Obsessions cause anxiety, distress. It is not pleasure. This directly contradicts their clinical nature, right? So, OCD obsessions are ego dystonic. They are distressing, they are unwanted, which is contrast to ego syntonic OCPD. Now, traps, dilemmas, and snags are central concepts in DBT, CAT, acceptance and commitment therapy, or interpersonal therapy. So, here the correct answer is cognitive analytic therapy. So, it formulates the maladaptive procedural patterns, which are traps, dilemmas, and snags, which are mapped collaboratively in a reformulation. Okay, in DBT, NIMHANS DBT is organized around skills, around mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness. It is not about traps, dilemmas, and snags. Acceptance and commitment therapy uses the 6 hexaflex processes. Its terminology is unrelated, right? It's about values, it's about diffusion. Then there is interpersonal therapy. It focuses on 4 problem areas: grief, role transitions, role disputes, interpersonal deficits. This is not about cognitive analytic therapy procedural concepts. So, traps, dilemmas, snags are about CAT given by Ryle. Alright, a major criticism of the original frustration aggression hypothesis, Dollard et al., is that frustration always leads to aggression. Frustration does not inevitably lead to aggression, nor is all aggression caused by frustration. It ignores biological drives, it applies only to children. Frustration does not inevitably lead to aggression, nor is all aggression caused by frustration. Again, this is very nicely covered in the app, in the module aggression, and it's there in the main lectures. Okay, so the original strong claim that frustration always produces aggression and aggression always stems from frustration, it was proved wrong. Miller later softened it. So, frustration produces a readiness for aggression, and Berkowitz reformulated it, right? He reformulated it around the negative affect and the aggressive cues. So, frustration always leads to aggression. This restates the original, the overly strong claim that was discredited. It is not the current position. It ignores biological drives. It is not the central classic critique. The model, in fact, evoked drive-like energy, and the main objection concerned its rigid one-to-one cause claim. So, no, this is not the answer. And it applies only to children. There is no such age restriction. The hypothesis was proposed for human aggression broadly. So, the revised view says frustration may produce aggression but not inevitably, and aggression has multiple causes. Okay. Now, a qualitative research method that develops theory from data by studying social interactions and processes is phenomenology, grounded theory, ethnography, or narrative analysis. Correct answer is grounded theory. So, given by Gleiser and Strauss, it builds that the theory inductively from data using constant comparison, coding, and theoretical sampling until categories are saturated, right? So here grounded theory builds the theory inductively from data. Okay. So we are building a theory inductively from data, where we are using constant comparison, we are using coding and theoretical sampling until the categories are saturated, जब तक खत्म नहीं हो जाते. Now, phenomenology. Phenomenology seeks to describe the essence of the lived experience of a phenomenon, right? It is descriptive, it is interpretive. It is not theory generating from social processes, so it's not the right answer. Ethnography, it studies a culture, it studies a social group through either immersion, through fieldwork. Its goal is cultural description, and it is not the formal theory induction process. Okay. Narrative analysis, it examines the stories and the accounts people tell to understand how they make meaning. It is not systematic theory construction. So, when you are building a theory inductively from data, that is grounded theory. So, B is the correct answer. Which measure of association is appropriate for two ordinal ranked categorical variables? Pearson's R, Kendall's tau, phi coefficient, or point Bisseral correlation? Correct answer is B, Kendall's tau, like Spearman's rho, right? It quantifies association between two ordinal ranked variables, which is based on concordant versus discordant pairs, right? Pearson's R, it requires interval or ratio data, and it assumes linear relationships. It is inappropriate for ranks. So Krishna sir taught you this in the live classes. Then the phi coefficient, it is used for two dichotomous, which is the binary variables in a 2 into 2 table. It is not about ordinal data, right? So it is about a 2 into 2 table, not about a ordinal data. Point Bisseral correlation. So here it pairs one dichotomous variable with one continuous variable. Neither variable here is dichotomous or continuous, right? So here two ordinal variables is Kendall's tau or Spearman's rho. Keep that in mind. Next, the don't hold tests on the Wechsler scales sensitive to decline are typically verbal subtests, performance subtests, vocabulary and information, or digit span only. So the correct answer here is performance subtests. So in Wechsler's deterioration index, the don't hold subtests decline with age impairment and are predominantly performance based, or these are timed. To give you a few examples, it is digit symbol coding, block design, or object assembly. This is in contrast to the relatively stable verbal hold tests. So note that the don't hold grouping also includes digit span and similarities, which are technically verbal subtests but are sensitive to decline, right? So the category is defined by vulnerability to deterioration. It is not strictly by verbal versus performance context. So this is not strictly by verbal versus परफॉर्मेंस सबटेस्ट से नहीं देखा जाता है, जबकि ये vulnerability to deterioration से देखा जाता है. So keep that in mind, right? So this is about the vulnerability to deterioration. Verbal subtests are the core verbal comprehension tests such as vocabulary and information. They are largely hold, resistant to decline. These are hold, which means resistant to decline. which is the opposite category. Some verbal tests like digit span and similarities are exceptions and they fall in don't hold. But verbal subtests are a class, they are not the answer. Okay. Then vocabulary and information, these are the classic hold subtests that remain stable. These are not the don't hold ones, right? These are hold subtests that remain stable. Okay. These are not the don't hold subtests. Digit span, too narrow. The don't hold group includes several tests, right? So here the don't hold subtests have several subtests. Digit symbol, coding, block design, similarities, not the digit span alone. So hold means, again, stable verbal scores. Stable verbal scores. Okay, which is vocabulary. ये डिक्लाइन नहीं करते, आपको आते हैं तो आते ही हैं ये, राइट. डोंट होल्ड is the decline sensitive subtests. This is the decline sensitive subtests. These are mostly performance or time based, right? These are mostly performance or timed. But remember the exception. This includes digit span and similarities. I hope this is clear. So B is the correct answer. Kohler's insight learning chimpanzee was Sultan. The chimpanzee associated with Tolman's latent learning research context is often confused, but latent learning was demonstrated in chimpanzees, rats, pigeons, or dogs. So here Tolman and Honzig demonstrated latent learning in rats in running mazes. Rats learned the maze layout without any reinforcement from cognitive maps. From cognitive maps, right? This revealed only once reward was introduced. Okay. Chimpanzees associated with Kohler's insight learning, this is a different paradigm and species. Pigeons, the classic subjects of Skinner's operant conditioning work, not latent learning. Dogs, Pavlov's classical conditioning subjects, right, unrelated to latent learning. So latent learning is Tolman's rats and mazes through cognitive maps. It is not a chimpanzee. Now, the verbal counterpart used alongside Raven's progressive matrices is Mill-Hill vocabulary scale, Peabody picture vocabulary test, Wechsler's adult intelligence scale vocabulary subtest, or Crackton vocabulary scale. So here the correct answer is Mill-Hill vocabulary scale. It was developed by Raven as the verbal companion to the non-verbal progressive matrices. It allowed a combined estimate of verbal and non-verbal ability. The Peabody picture vocabulary test is a separate, independently developed test which was receptive of vocabulary test. It is not the designated Raven's counterpart. The Wechsler Adult Intelligence Scale vocabulary subtest is a component of the Wechsler battery unrelated to Raven's design, and the Crichton vocabulary scale is a genuine Raven associated scale, but it is paired with the colored progressive matrices for children for the lower ability groups. So the standard verbal counterpart for the main matrices is Mill-Hill. Alright. Now, in habit reversal training, HRT, for tics and trichotillomania, the procedure that increases the client's recognition of when the habit occurs is called competing response training, awareness training, social support, or relaxation training. So, this is awareness training. It is the first core HRT component. It teaches the client to detect the habit, and it is premonitory urges for the early signs. It's a prerequisite for intervening. Okay, so competing response training, it installs a physically incompatible behavior to perform when the urge arises. So it is the response to awareness, not the recognition step itself. Social support, it enlists the significant others to praise the success and prompt practice. It supports adherence but does not build self-recognition of the habit. Relaxation training, it reduces the general tension or the arousal that can trigger habits. It is a useful adjunct but not the component which is aimed at recognizing the occurrence. So HRT begins with awareness training which detects the habit and its antecedents. Okay. B is the correct answer. Moving on. Flash bulb memories are characterized by high accuracy and high subjective confidence. High subjective confidence despite often poor accuracy, low confidence and low accuracy, and perfect lifelong retention. So the correct answer is high subjective confidence despite the poor accuracy. So flash bulb memories feel exceptionally vivid and they are held with great confidence. Yet research shows their accuracy degrades over time and is no more reliable than the ordinary, the autobiographical memories. Alright, so here high accuracy and high subjective confidence, it overstates accuracy. The key finding is the dissociation between high confidence and unreliable accuracy. Then low confidence and low accuracy, it's the wrong on confidence, right? The defining feature is high subjective confidence over here. Perfect lifelong retention, it is directly contradicted by the evidence of distortion and decay over the years. So this is incorrect. So flash bulb memories is high confidence but not high accuracy. So B is the correct answer. Okay. So type D distressed personality is characterized by the combination of negative affectivity and social inhibition, time, urgency and hostility, optimism and extroversion, or neuroticism and openness. So here the correct answer is negative affectivity and social inhibition. So Denollet's type D personality combines chronic negative affectivity. It's about worry, it's about gloom, it's about irritability, and it combines it with social inhibition. You suppress the expression in social context. So it predicts poorer cardiac outcomes. Okay. So time, urgency, and hostility, these are hallmarks of type A personality, different cardiac risk construct. Okay. Optimism and extroversion, these are protective, adaptive traits, essentially the opposite of distressed type D profile. Neuroticism and openness, two big five traits, but openness is not part of type D. The defining pair is negative affectivity plus social inhibition. So negative affectivity plus social inhibition is a cardiac risk which is typical to type D personality. Moving on. In signal detection theory SDT, a D prime value greater than 3 indicates poor discriminability between signal and noise, excellent discriminability between signal and noise, a liberal response criterion, or a chance level performance? So the correct option is B. So the D prime index's sensitivity is the separation between the signal plus noise and the noise distributions. So larger the value means better discrimination, right? So this reflects excellent sensitivity. Poor discriminability between signal and noise, that would correspond to a small d prime value near 0, which is the opposite of 3 and above, right? A liberal response criterion is a response bias which is captured by a beta, not by prime D, right? So here it is independent of where the criterion is set. The chance level performance, it is the chance performance if it corresponds to 0, right? Where the D prime is equal to 0, it can't be more than or equal to 3. So in SDT, sensitivity is large. When it is large, then there is excellent signal or noise discrimination. So keep that in mind. Moving on. Transcortical motor aphasia results from lesions typically located in the temporal lobe, frontal lobe, occipital lobe, or parietal lobe. So the correct answer is frontal lobe. The transcortical motor aphasia arises from the frontal lesions anterior or superior to Broca's area. So this often involves supplementary motor area connections which produces reduced spontaneous speech with preserved repetition. So here in temporal lobe is the incorrect answer because it is about the vernix area. Lesions cause fluent receptive aphasias, right? So in vernix, the transcortical sensory aphasia is caused, not the non-fluent transcortical motor type aphasia. Okay, so temporal lobe is the incorrect option. In occipital lobe, it is concerned with vision. So lesions here cause visual defects like alexia or the cortical blindness, right? So it is not aphasia of this kind. Fine. Parietal lobe is about the parietal lesions which relate to the conduction aphasia or the Gertzmann syndrome and the apraxias, not transcortical motor aphasia. So the transcortical or the motor aphasia is the frontal lesion which is near or above the Broca's area with preserved repetition. Okay, so B is the correct answer here. Now, the true mean of an entire population as opposed to a sample is termed as statistic, parameter, sample estimate, or standard error. So it is known as a parameter. So a parameter is a fixed numerical characteristic of an entire population, which is the population mean. Yeah, its sample based counterpart is a statistic. Okay, so sample based counterpart here is statistic. Now, statistic is a value computed from a sample, right? The sample where the sample mean is x. So it is used to estimate the parameter, not the population value itself. Sample estimate is by definition derived from a sample, hence it's not the true population value. Standard error, it is the standard deviation of a sampling distribution. It is a measure of estimation precision. It is not a population mean. So here the population value is parameter, sample value is statistic. So B is the correct answer. Now, a correlation coefficient used when one variable is genuinely dichotomous and the other is continuous is the point Bisserel correlation, Spearman's rho, or the phi coefficient. So here the correct answer is point Bisserel correlation. So the point Bisserel correlation applies when one variable is a true dichotomy, like either you've passed or you've failed, either one is alive or dead and the other is continuous. Okay. Bisserel correlation is used when the dichotomy is artificial. It reflects an underlying continuous distribution that has been split, high versus low, from a continuous trait. It is not a genuine dichotomy. Okay. Spearman's rho is a rank order coefficient for two ordinal variables. It is not a dichotomous continuous pair. Phi coefficient for two dichotomous variables, 2 into 2, not one dichotomous and one continuous. Okay, so true dichotomy is where there is continuous variable. Point Bisserel is the correct answer here. Bisserel is artificial dichotomy. Okay, keep that in mind. Moving on. Neurofeedback is theoretically based on insight and reinforcement, operant conditioning and procedural skill learning, classical conditioning only, or cognitive restructuring. So the correct answer is operant conditioning and procedural skill learning. So neurofeedback trains the self-regulation of brain activity by reinforcing target EEG patterns with gains consolidated as procedural skill learning, right? So the target EEG patterns by the brain activity when it's reinforcing it, that is operant conditioning. Insight and reinforcement. Insight is not the mechanism. Neurofeedback can work without conscious understanding of how the regulation is achieved. Classical conditioning. Neurofeedback is fundamentally operant reinforcement of voluntary self-modulation. It is not purely Pavlovian stimulus-stimulus pairing. Okay. Cognitive restructuring, it is a verbal or the cognitive CBT technique challenging the thoughts. So, neurofeedback regulates the physiological signals, right? It is regulating the physiological signals, not the thought content. So, neurofeedback is operant conditioning of brain activity, which is self-regulation. So, keep this in mind. B is the correct option. Pairing a non-anxiety provoking, which is relaxation stimulus, simultaneously with an anxiety provoking stimulus to replace the anxiety response is the principle of reciprocal inhibition, counter conditioning, flooding, extinction, or negative reinforcement. So, we have already discussed this. It is reciprocal inhibition or counter conditioning via Volpe's reciprocal inhibition, right? So, here the counter conditioning replaces the anxiety response by pairing the feared stimulus with an incompatible relaxation response. So, relaxation comes to displace the anxiety, right? Flooding, where you use intense, prolonged, upgraded exposure to the feared stimulus without relaxation, relying on the habituation or the extinction rather than substituting an incompatible response, right? Extinction weakens a conditioned response by repeatedly presenting the conditioned stimulus with the unconditioned stimulus. It removes a pairing rather than creating a new relaxation pairing. So, this is also incorrect. Negative reinforcement, it is an operant process that increases a behavior by removing an aversive stimulus. It is not the counter conditioning of an emotional response. Okay, so when you are replacing anxiety by pairing with relaxation, it is reciprocal inhibition or the counter conditioning given by Volpe. Keep that in mind. Now, among standard Indian intelligence tests, the one that yields an actual IQ rather than social quotient or screening estimate is the Wechsler's intelligence scale, BKT, Vineland social maturity scale, Seguin form board, or Bhatia's battery. Okay, now the correct answer is PKT or MISIC. So, amongst the Indian standardized tests, the Malins Intelligence Scale for Indian Children, which is MISIC, which is the Indian adaptation of the Wechsler's, and the Binet-Kamat test, BKT, the Indian adaptation of the Stanford Binet, yield an actual IQ, which is either deviation or ratio. So, whereas the other instruments give a different metric or only a screening estimate. Now, the VSMS, it yields a social question based on the adaptive of the social functioning. It's not giving you an IQ. Seguin form board, it is a brief performance or the screening measure of visuomotor speed. It is used as a quick estimate, not a full IQ. Bhatia's battery provides a test age and can be converted to an estimate, but it does not directly yield an IQ the way MISIC or BKT do, right? So, for a genuine IQ among Indian tests, use MISIC, BKT, use Vineland for the social question, use the Seguin form board for the screening, and Bhatia for test age. Okay, now on Vineland social maturity scale, Indian adaptation, the social question range used to indicate mild intellectual disability is approximately 70 to 84, 50 to 69, 35 to 49, or 20 to 34. So here the correct answer is B. Mild intellectual disability corresponds to approximately to an SQ/IQ band of 50 to 69, mirroring the standard severity bands for intellectual impairment. Okay, 70 to 84, it denotes borderline intellectual functioning above the mild impairment range. 35 to 49, moderate intellectual impairment. 20 to 34 is severe intellectual impairment, right? So the correct option is B. Now, the don't hold subtests in Wechsler's deterioration index sensitive to cognitive decline classically include which of the following options? So option B here is the correct option. So the don't hold subtests, they decline with age or impairment, and they classically include digit span, digit symbol coding, block design, and similarities. Whereas the relatively stable hold subtests are vocabulary, information, object assembly, and picture completion. Okay. So the grouping is defined by vulnerability to deterioration rather than by verbal versus performance content, which we already discussed in the previous questions, right? This is the reason why verbal subtests such as digit span and similarities appear in the don't hold set. Okay, now vocabulary, information, and picture completion are all classic hold tests because these are stable. So this set is the wrong category. The comprehension and vocabulary only are both verbal hold tests. These are again resistant to decline. It is the opposite of don't hold. The object assembly and information both are classic hold tests, right? Object assembly and information are pretty much stable. So this pairing also misidentifies the decline sensitive group. So it's the wrong option. The correct is B. So by this, we complete the memory-based recall questions for NIMHANS 2026. I'm very happy to see that majorly 90% of what has been asked in the exam was either covered in the live classes or is already there in the main lectures. So I would urge all of you to subscribe to the app and be a premium user to benefit it from the most. And I wish you happy learning. Thank you.
Let us discuss the questions that were asked from abnormal psychology in the NIMHANS MA Clinical Psychology entrance examination. The first question was a good one. So in ICD 11, the diagnosis gender incongruence has been. So let's talk a little bit about gender incongruence first. So what is gender incongruence? If a person's assigned gender does not match with the experienced gender, if these two are not matching and it is causing distress and dysfunction, then we call it gender incongruence. What is assigned gender? Say a child is born, a baby is born, based on the organs. You assign a gender to the baby. Say a baby is born, he has penis and testes, so the doctor says that it's a male child. That is assigned gender, primarily on the basis of the organs, sex organs. Now this baby grows up, what he or she identifies with, the gender that the person identifies with is called as experienced gender. So if the assigned gender and the experienced gender are not matching and it is causing distress and dysfunction, then we call it gender incongruence. In ICD 11 we call it gender incongruence. In DSM we call the same situation, the same condition as gender dysphoria. Gender dysphoria. Now earlier in ICD 10 all the sexual disorders were categorized under the mental disorder chapter. Now in the newer edition they said that we don't want to pathologize everything. We cannot say that all sexual disorders are mental disorders, and that is why what they did, they took away the sexual disorders from the chapter on mental disorders and put them into a new chapter. The chapter is called as conditions related to sexual health. Conditions related to sexual health, right? To decrease the stigma. So this is the answer. Gender incongruence in ICD 11 has been moved to a new chapter called as conditions related to sexual health. Option A, B and D are incorrect. Alright. Which drug is classically used to produce model psychosis in experimental settings? So we wanted to study psychosis like schizophrenia, and to study it scientists wanted to create a situation where the same symptoms are present, the hallucinations are there, the delusions are there. So initially they tried using drugs like LSD and even mescaline. So these are serotonergic agents. What is the meaning of serotonergic agents? They worked on serotonin receptors. Acted on serotonin receptors. So when you give a person LSD, he may start developing illusions. He may also start developing hallucinations. But all the symptoms of schizophrenia were not replicated. Schizophrenia has delusions, hallucinations, then there are negative symptoms, cognitive symptoms, multiple types of symptoms are there. So although LSD and mescaline were used to create model psychosis, but this was not a very good way of replicating the symptoms of schizophrenia. So classically LSD and mescaline were used, and this is the answer. But today this is not the best way of creating model psychosis. Say they change the question. They say which drug is used to produce model psychosis in experimental settings now. Then the answer becomes something like ketamine or PCP. Ketamine or PCP. PCP is phencyclidine. So while the LSD worked as a serotonergic agent and led to the development of illusions, hallucinations, ketamine and PCP can create delusions, hallucinations, even the negative symptoms of schizophrenia. So they are the better model drugs today for replicating the symptoms of schizophrenia. So they are working as NMDA receptor antagonist. NMDA receptor antagonist. NMDA is a receptor of which neurotransmitter? Glutamate. Glutamate. So these are glutamatergic agents. These were serotonergic agents. In between, even dopaminergic agents were used. Dopaminergic agents were used, like amphetamines were also used. So classically we used LSD and mescaline, which were serotonergic agents. We also used dopaminergic agents like amphetamine, but today the best way of creating model psychosis is to use glutamatergic agents like ketamine and phencyclidine. But the answer here is C, LSD, because they're asking about the classical use. Preventing a disorder before it occurs by reducing risk factor is called as primary prevention. What is primary prevention? When you take care of the risk factors, when you manage the risk factors to prevent the or to decrease the incidence of an illness. When you are working on the risk factors to decrease the incidence of an illness, that is called as primary prevention. For example, say we are trying to prevent the or decrease the incidence of diabetes mellitus. Now we know that one of the most important risk factor for diabetes mellitus is weight. Increased weight is one of the most important risk factor that causes diabetes. Smoking. Now if you start a program in which you increase the awareness about the fact that smoking can cause diabetes, weight gain can cause diabetes, and you take actions to decrease the weight of the population or decrease the people who are smoking, you would be decreasing the incidence of diabetes mellitus, and this is primary prevention. What is secondary prevention? When you try to do the early screening, when you try to do the screening for a disease so that you can catch it early and you can start the treatment early. Early screening. For example, in a population, say you take the blood sample of everyone and you see who has gotten high blood sugar. So even people who have high blood sugar and who do not know that they have high blood sugar, people who have developed diabetes but they are not aware of it, by running this screening, you are able to catch people who have just developed the illness so that you can start the treatment early. This is secondary prevention. By screening and catching the illness early, you are preventing the progress of the disease. Tertiary prevention is when you act to prevent complications. You are trying to act to prevent the complications. For example, diabetes. If diabetes continues and it is not controlled, it can cause many complications like damage to eyes, something called as retinopathy. The retina becomes damaged. It can cause damage to your nerves, neuropathy, which can even lead to amputation. So in tertiary prevention, what you do? You prevent the complications. So you are treating the patient with diabetes regularly so that the diabetes does not progress to the complications like neuropathy and retinopathy. This is the tertiary prevention. Quaternary prevention is when you prevent the damage due to over medicalization. What is over medicalization? So people who have diabetes have high blood sugar, but if you treat them very aggressively, if you give a very high dosage of medications, you may actually decrease their blood sugar levels, called as hypoglycemia. Now hypoglycemia can be even more dangerous than hyperglycemia. Lower blood sugar levels can be even more dangerous than increased blood sugar level. So this is over medicalization. You are giving such a high dose that it is causing more harm than benefit. This is quaternary prevention. So primary prevention, you decrease the incidence of a disease by working on the risk factors, decreasing the risk factors. Secondary prevention, you catch the disease early by doing the screening test. Tertiary prevention, you prevent the complications. Quaternary prevention, you prevent the complications due to over medicalization. So because we are reducing the risk factors, this is primary prevention. Sodium amytal interview or sodium amobarbital interview is primarily used too, although it is no longer used that frequently. But so say a patient has a dissociative disorder. Say a patient has dissociative amnesia. What is dissociative amnesia? The patient is not able to recall the memory for a traumatic event. There was a traumatic event and the patient does not remember it. Why the patient does not remember it? Because a defense mechanism of repression was used. to hide that event in the unconscious mind. Your mind used the defense mechanism of repression and took the memory of a traumatic event and hid it hid it in the unconscious mind. This repression is the barrier. It does not allow the memory to come back. Now in sodium amytal interview, what you do, you keep giving the patient sodium amobarbital. It is a kind of barbiturate. So when you give sodium amytal, which is the kind of a barbiturate, so barbiturates, what they do, they cause sedation. They make you feel sleepy. They make you feel sleepy. So when you keep on giving the sodium amytal, the patient goes from a state of being awake to the state of being sleepy, but you don't induce sleep. You just decrease the awareness. You decrease the inhibitions, right? It is a state between being awake and being completely asleep. Half asleep you can consider. So when the person is in this half asleep period state, the defenses, they become weaker. So when the defense of repression becomes weaker, now the memory can come out. The memory can go into the conscious mind, and now patient can have what is called as abreaction. What is abreaction? What is the abreaction? Remembering the memory with release of emotions. The person recalls something with release of emotions. For example, say the traumatic event was, say, death of parents. The parents died in an accident. Repression had hidden that in the unconscious mind. Now you gave sodium amobarbital. The defenses became weak, and now the patient is able to recall that event and now cries a lot. Recall of a trauma with release of emotions. This is abreaction. So it is used to facilitate the recall of repressed or dissociated material. Nowadays not frequently used, but can be asked. Induction of general anesthesia, no, that is not the primary purpose of sodium amytal. For general anesthesia, we can use drugs like thiopentone, right? Drugs like thiopentone can be used, or something like propofol can be used, but they are the sodium amytal is not used for it. Treat refractory depression, no. This drug has, sodium amytal has no role in depression treatment. Diagnose epilepsy, no. You don't use sodium amytal to diagnose epilepsy. Although sodium amytal is sometimes used during the surgery for epilepsy. If an epilepsy is not getting better with medications, sometimes surgery is done. For that, sodium amytal can be used, but not for diagnosis. McNaughton's rule that establishes criminal insanity based on the defendant's inability to. So criminal insanity. Now basically somebody has, say, committed a crime, say somebody has committed a murder, and now they are making a defense on the basis of insanity. The lawyer is saying that this person has a mental illness because of which he cannot be held guilty for this murder. So what does court use in such cases? So there is a rule called as McNaughton's rule. McNaughton's rule. So McNaughton's rule is clearly defined. So let me show you the definition. If you want to establish a defense on the ground of insanity, it must be clearly proved that at the time of committing the act, at the time of doing the murder, the person accused had such a defect of reason from disease of the mind. So yes, he had a mental illness because of which he was not able to reason properly, and he did not know the nature and the quality of the act that he was doing, or if he did know, he did not know he was doing what was wrong. So because say a person has schizophrenia and the person has a delusion of persecution that a particular person wants to kill me and my entire family, and acting on that delusion, he kills that person, that before he kills me and my family, let me kill him. And now the lawyers are able to prove that when he murdered the other person, because of the schizophrenia, he was not able to reason properly. When he was killing the person, he did not know that the act that he was doing was wrong, or he did not know the nature and quality of the act that he was doing. So because that person, because of the delusions at that time, believed that he was about to be killed and he took an action, you can say in self-defense, we can prove that because of the disease process, this thing was committed and the person was not aware of the nature of the act that he was doing, or what he was doing was wrong. If this can be proved for that moment, that when the person was murdering the other person, at that time he was not able to reason out, only then you can defend the client on the basis of insanity. Otherwise not. So that is why in courts, if a person with a mental illness commits some kind of crime, very rarely the court allows the lawyers to use insanity as a defense, because it's very strictly defined how to establish the insanity as a defense. So control impulses know the nature and wrongfulness of the act. So yeah, this is the answer. Control impulses. So there is another act called as irresistible impulse test. Similar to McNaughton's rule. So what happens in irresistible impulse test? So a person cannot be charged with a criminal offense. A person charged with a criminal offense is not responsible for an act if that act was committed under an impulse that the person was unable to resist because of a mental illness. What does it mean? So if you can prove that the person did a crime because he had such an impulse that he was not able to resist because of a mental illness, then again you can use the defense of insanity. Then only you can use the defense of the insanity, that is called as irresistible impulse test. The name is self-explanatory. So this is the answer. Under the Mental Health Care Act 2017, the document allowing a person to state treatment preferences in advance is called as. So Mental Health Care Act 2017, in India, the act that regulates the right of a person with a mental illness, how the treatment should be given. So this act talks about something called as advance directive. So all of us today can write on a piece of paper that if tomorrow I develop a mental illness, and because of that mental illness I am not able to take the treatment decisions for myself. I say that if tomorrow I develop schizophrenia, and because of that schizophrenia, if I am not able to take decisions for myself, this is how you can treat me, and this is what you cannot do. For example, I say if tomorrow I develop schizophrenia and I cannot take my treatment decisions, you can give me electroconvulsive therapy, ECTs. You can also give me injections, but you cannot admit me. And I sign the piece of paper and I upload it. Tomorrow, if I develop schizophrenia, my treatment must be done according to that piece of paper, which is called as advance directive. I have given in advance a directive how to treat me, and also how not to treat. Both things, how to treat and how not to treat. My treating psychiatrist has to follow it. What is nominated representative? I can also say that if I develop schizophrenia, my wife will help take decisions for me. In that case, my wife becomes the nominated representative, the person who will help take decisions. So these two are important: advance directive and nominated representative. Frigoli syndrome. So we have got two delusional misidentification syndromes. Delusional misidentification, also called as misidentification syndromes. The first one is Capgras. Capgras itself is a mnemonic. C stands for close person got, so cap got replaced by a stranger. CPGRAS. The patient believes that a close person got replaced by a stranger. For example, a patient comes into his home and he enters the drawing room. He looks at his wife and he has this belief that this wife, who is a close person, this wife is actually not his wife, but a stranger who just looks like his wife. Patient says, my wife has been replaced by a similar looking stranger. Similar looking stranger. Patient says a close person, wife, has been replaced by a similar looking stranger. So what is the history that you will get? This patient goes back home and starts fighting with his wife. That who are you? How did you enter my home? How do you look exactly like my wife? So patient believes a close person, wife, has been replaced by a similar looking stranger. The other one is Frigoli syndrome. It's the opposite. Frigoli syndrome is patient believes close person is disguising as a stranger. Disguising as a stranger. Disguising as a stranger. Now the patient says, my wife is changing her appearance and changing the appearance and taking the appearance of a stranger so that I cannot identify her. For example, this patient is walking on the road, he sees a random female and he goes and starts fighting her that you are my wife. You have changed your appearance. You are disguising as a stranger and you are following me and you have changed your appearance so that I am not able to identify you. So Capra's person is fighting with his wife, accusing her of being a stranger. Frigoli person is going and fighting with random females, saying that you are actually my wife, you have changed your appearance. So Capra's person fights with close person. Frigoli syndrome patient fights with strangers. Remember one, the other one is the other one. Capgras yaad kar lo. That close person got replaced by a stranger. Frigoli, what would be the Frigoli then? Close person is disguising as a stranger. So a familiar person has been replaced by imposter. This is actually Capgras. Different people are in fact a single person disguised. This is Frigoli. So patient thinks that a close person is disguising as a stranger and that the close person can take different appearances at different times. Today the patient went and fought with one person, tomorrow he fights with somebody else. That today you have taken this appearance. So single person is basically disguising and taking appearance of different people. One is already dead. This would come under nihilistic delusions. Nihilistic delusions. Right? Now let's talk about the trans-theoretical model stages of change. Whenever a change has to happen, say a person who is drinking alcohol daily has to quit alcohol. So the best model for the stages of change is called as trans-theoretical model. It says the stages are, the first stage is pre-contemplation. What is the meaning of contemplation? I am contemplating about something. मैं सोच रहा हूँ किसी चीज के बारे में. I am contemplating whether to go to this college or that college, which means I am thinking about it. Pre-contemplation means I am not even thinking about anything. I drink alcohol and I am not even thinking about any changes. So, not even thinking. The next stage is contemplation. Now the person starts thinking the pros and cons. The patient thinks that if I continue drinking alcohol, it is good because I have a good social life because of it. I meet friends. But there are problems because of alcohol use. I am having fights with my wife. I am having fights with my girlfriend. It is very costly. I have to spend a lot of money. So now he's thinking pros and cons. Should I do it or should I not do it? This is contemplation. Second stage. Then the third stage is the patient decides that okay, I will quit. Now you have taken the decision and you start preparing for it. The patient says, I will quit alcohol and this Saturday I will go and meet a doctor. Fourth step is action. When patient actually takes a step. So now on Saturday patient has quit alcohol and he has also stopped meeting the friends with whom he used to drink. And the final stage is called as maintenance, when the behavior is maintained or continued. So now this person is not drinking alcohol. He has stopped it. One could be relapse when he goes back to that behavior. So now the stage in which the person has no intention to change, which one would it be? When he is not even thinking about it, pre-contemplation. Kegel exercise, these are the exercises which are used to strengthen the pelvic floor muscle. So say a person has urinary incontinence. So sometimes seen in females who have had multiple pregnancies. So during pregnancy, during delivery, the pelvic muscles get stretched a lot, and as the females get older, because of the weakness of pelvic muscle, there may be incontinence of urine, right? Say the female laughed loudly, there may be leaking of urine. Also for certain sexual disorders like premature ejaculation, because the person is not able to hold, he ejaculates early. So if the pelvic muscles are stronger, he would be able to hold it better. So for these Kegel exercises can be used. They primarily help in strengthening of the pelvic floor muscles. Approximately how much beverage equals one standard unit of alcohol? So one standard drink is 10 ml of absolute alcohol. One standard drink is defined as 10 ml of absolute alcohol. Now whiskey, the spirits as we call them, spirits like whiskey, vodka, rum, all of them have 40% alcohol volume by volume basis, which means if you have 100 ml of whiskey, out of that 100 ml, 40 ml would be absolute alcohol, pure alcohol, 100% ethanol. 100% ethanol. So whiskey, rum has 40% absolute alcohol volume by volume. Now it is asking, the question asking, one standard unit of alcohol will be equivalent to approximately how much of the beverage. So one standard drink is 10 ml of absolute alcohol. So how many ml of whiskey will have 10 ml of absolute alcohol? How many ml of whiskey will have 10 ml of absolute alcohol? So I said that if there is 100 ml of whiskey, it has 40 ml of absolute alcohol. The question is asking, in how many ml of whiskey will we have 10 ml of absolute alcohol? So 40, 100, you divide it, it comes out to be 25 ml. Right? 40% है ना, so 25 का 40% 10 ml हो जाएगा. Or in other words, if 40 ml of absolute alcohol is present in 100 ml of whiskey, 10 ml of absolute alcohol will be present in 10 into 100 divided by 40, right? 100 by 4, which comes out to be 25 ml. So our answer is 25 ml. Now look at the options. The closest option is 30 ml. So this becomes the answer. कुछ basic mathematics revise हो गई हमारी. So these were the questions from abnormal psychology in the NIMHANS exam. Thank you.